Hello, everybody. So, as we know, our public services, our local authority, our health service too, in years to come, in about 10 years, it will happen. It's inevitable. We see the HSE at the moment, it's a total mess. There's billions being popped in. I don't know where the billions are going, but they're basically going into a black hole that it doesn't go to any use pretty much. It goes to people sitting in offices. But long story short, we see our local authorities for a perfect example. In years to come, there'll be probably nobody working on the local council doing the roads in terms of maintaining the roads because it's all outsourced now. We have companies literally coming from Northern Ireland. We're paying companies, men from Northern Ireland, to come down and do roads and carving in other parts of the country. When we should be employing local men and giving them a proper job, a good paying job, a good pension and stuff. That's what they did years ago. They employed local men. They took people off the door to put them onto the councils, the local authorities, city councils, county councils, to do the roads or even clean up and stuff. Nowadays, it's all outsourced. To outsource it. We have a road sweeper that comes around Carver does not even belong to the council, it belongs to a private entity that the council have to pay. And it's all outsourced. The same with the HSE. We see with operations and stuff. People are waiting. I know a person who's waiting now. Nearly 6 months for an operation on the HSE waiting list. He's waiting for his back to be done. 6 months he has to wait, and he's pretty much bedridden. He can go up and down to the toilet, but pretty much he can't stand up for a long period of time. So pretty much I know he's a man in his 60s, he's retired now, but still at the end of the day, 6 months, he has, and God knows how much another 6 months, 7 months, God only knows. But what I'm trying to say is they told him in the HSE if he went private, if he paid for it, he'd get it done within 2 weeks. But he would have to fork out, 7,000 or so for a private operation to get it done and stuff like that. See, that's what it's turning into. The HSE is basically turning into the American style health system that you have to pay. It's the same with the NHS in England. And it's going to be the same probably pretty much all over the Irish system. It's the same with the Young Garda Sína Cod at the moment now. You nearly would probably have to pay Young Garda Sína Cod to come out. But it's the same with education. Special education. So people have to pay for private schools now because the education system's just fucked in this country. And nobody can get any special needs help and stuff. And they're suggesting that people pay out of their own pocket for private schools and private SNAs to come in and help young people with disabilities and dyslexia and other special needs cases. And that's what's been happening. It's all pretty much outsourcing public works. And particularly the main thing I'm very annoyed about is the local authorities and stuff should be employing men. It was that years ago they employed thousands of men. Nowadays it's all just left. They want people to volunteer, do it for nothing, pretty much tidy chance groups and stuff. And it's not good enough because at the end of the day, these people are working 40-hour week. They're trying to pay their rent. They're trying to pay for their bills. They shouldn't have to go out and do the council's work. And the sitting councils sitting there getting big salaries and stuff. They shouldn't have to. But this is the thing. I'm very worried because I'm always public works is the same with the HSE and stuff, and to do with the roads and stuff should be, government work, not private entities. It was done for thousands, since the foundation of our state. For the last before recently brought up into the 2000s, it was always through the state. The state always done it. And now through the detriment of some cases because the councils take years to do it. But what I'm trying to say, they employed local men, the local people got jobs, local young lads got jobs, and good paying jobs, good pensions and stuff. Nowadays that's non-existent. That's not. They won't employ anybody in the councils. To what basically private contractors to do it. And they say it's cheaper to get private contractors, but there's not much in the difference, to be told. There's not really much of the difference. Between it. And it doesn't make any sense why you would go all the way up to Northern Ireland to get private contractors too, where you wouldn't employ a few young lads that are down the road, in a private company, they're well paid. So it doesn't make any sense to me, but a lot of things in this country doesn't make any sense to anybody. But this is the thing. And the same with the HSE, we shouldn't let it, we shouldn't let it become an American style, that people have to fork out the money any time they get sick. It's the same with the HSE, with doctors now. You can't get doctors. People have to go to private doctors. I know a man who was sick. He just had the flu. He needed antibiotics. He had a bad chest infection. He was looking for the doctor. He couldn't get the doctor. Simple as that, because there's no doctor. The doctor he had retired, and there was nobody to take his place. So there's a standing doctor here and there. But what I'm trying to say is, at the end of the day, he had to go to a private doctor, private clinic, pretty much, to see a doctor to get prescribed these. So he had to fork out €1,000 just to get it. Just to get to the private doctor. That's what I'm saying. This is what's happening in Ireland at the moment. So at the moment there won't be any GPs. My GP too, when he retires, there might be nobody would take over from him because he's supposed to be retired. He's 70 something. He's supposed to be retired long ago, but they can't get a new GP, so he was asked to stay on until they get a new GP, which is not going to happen because they can't get them. It's simple as that. But this is the thing. People have to fork it out. That's what I'm trying to say. If my GP goes in the morning, there probably won't be one to replace him. And that's be it. It'd be paying for private clinics to go and get tablets and stuff like that. It's insane. But we can't let it happen in Ireland. It's simple as that. We can't let it happen, particularly on the local authority level. We can't let these things happen. But public walks in terms of employing young people to do public walks around the place, even just picking up rubbish and doing things like that. It's a very important work for the community, not for anybody else, not for them even just giving them a job. It's important for the communities that we keep our communities clean and we keep our communities vibrant and clean and nice and tidy, because it does instill pride in people and a sense of belonging and community. But at the moment of time, it's just that's all gone out the window. Years ago, people cared about that. That's all gone out the window nowadays, because the government just don't give a shit, and the majority of local authorities don't give a shit either. But this is the thing. We have to. We can't let it, because especially the education system, the health service. We see it all the time. Unfortunately, I'm seeing it every day too. Literally, people waiting months, years for appointments for anything. Like it's insane. And you do feel for these people, because a lot of these people are in pain and they've been told to wait for months and months and months on the waiting list. But if they pay privately, they get seen to it in a week. It's just a rotten system. The system in this country is just rotten. It's going to be rotten. Unfortunately, this is the way it's going. In the next 10 years, it'll be 10 times worse. It's only starting to creep in now. Like more and more. Every week, it's creeping in more and more and more. Like the local authority bit, that was the beginning of it, really. What I'm trying to... Well, that's why I'm suggesting that, because it was the beginning of, in the 2000s, they started getting rid of councilmen. When councilmen retired, they never took on any new councilmen. And then this thing kept going and going, and now here we are today. It's the same in the town. There's two people on the... Used to be the town council. They got rid of the town councils in the around 2010 and stuff. They got rid of the town councils for the towns and stuff around the country. But there was two men that's left in it now, still, and he's the new retirement age, another few years, they're retired. And they're two men, and when they go, nobody's to replace them. Simple as that. They're going to get rid of it. They're pretty much nobody doing it. There might be a few councilmen, who are on the roads doing it, but there won't be designated people in Cavan Town, take for example. And that's just another thing too. It's just left the people to do for nothing. Excuse my language, but it's all good working for nothing, but. It's not appreciated by your councils, by your TDs. It's not appreciated. You're pretty much treated like a fool for going out and doing it, to be totally honest. In the highest degree. And especially people going out after doing a 40-hour work week, suggesting they go out and do it and stuff like that. It's beyond ludicrous. When years ago to employ people, give people proper jobs, good paying jobs to do it. But they don't want to pay anybody to do anything nowadays, the state. They want people to do things for nothing. And it's not good enough. And again, I'm just suggesting to people who have to stand up forward, because if we don't, in the years to come, our children will feel it. And that's the sad reality, because it's already creeping in.